Good afternoon. So my name is Ellis, and I'm a Digitising Social Care Programme Manager working across Bedfordshire, Luton and Milton Keynes integrated care system. And today I'm just going to give a few highlights about some of our funded pilot projects and give a bit of a flavour about some of the digital technology that we've been working with. So we're a small programme team, and we work across with our system partners to deliver the social care programme. And they are pilot projects with targets and deliverables set by NHS England. We work with a number of the different system partners, including care providers and the care market, technology suppliers, and other colleagues across the system to evaluate the benefits and find out the impact of this pilot technology. And so, as I say, today we'll just give a bit of an overview of some of those projects. Not all of them have been fully evaluated, so we have more information on some than we do others. So this gives a bit of an idea about the system that we work with. You can see that we work with local authorities, acute trusts, mental health trusts, primary care, ambulance service and care providers. And we really try to work in true partnership with our system partners so that we can co-design some of the projects together, make sure that they're going to do what we hope they will do and really provide benefit for people, and in particular benefits to residents and to our care providers. So this slide just gives you an idea of some of the current projects that we're working on within Bedfordshire, Luton and Milton Keynes. Quite a wide variety we've worked on for a number of years recently. So the first project that I'm going to talk about is the Wazan Blue Box telehealth monitoring. So this is essentially, it looks like a blue suitcase, and it contains portable kit to take measurements for residents and individuals. So things like pulse, blood glucose, blood pressure, respiratory rate, temperature, that kind of a thing, so that care providers can understand a baseline for individuals and know what's normal for them. That information is captured within a system, and it will take those readings, and it can do things like calculate an News 2 score, and basically picking up early warning signs or changes for an individual. The data will also integrate with System 1 so that GP can pull the information straight into a patient record. And we've successfully piloted that with 2 GP practices and a number of care providers too. So some of the anticipated benefits for individuals, obviously that earlier identification of things changing should lead to quicker intervention and hopefully prevention of things escalating. And for the providers, it's given them more confidence in making decisions. It's not for medical staff, so anybody can use this equipment, but it will give them real data to make their decisions and base their information and conversations on. And then hopefully that will lead to some efficiencies in their care provision. And then for the system-wide benefits, the idea is that if you're making better informed decisions, we should hopefully see a reduction in things like NHS 111 calls, GP appointments, that kind of a thing. Maybe a reduction in ambulance call-outs and then A&E and hospital admissions. Conversely, though, if that data is showing that an individual is starting to show signs of change or something that's of concern, then it means that they can confidently make those calls. So we as a programme team can look at things like take-up and usage across the care providers, and it is varied. Some use it really well and it's fully embedded in their practice. Others need a little bit more encouragement and help. We give face-to-face training when we deliver the kit to people. And there's online refresher training that's available from the tech supplier as well. So we do offer a lot of support where we can see it's not being used to its full potential to try and help people to use it better. So the next couple of pages really are just some feedback. So I'll pause so that people can have a quick read. And I will read one in particular, which has come from a GP who says the equipment's very simple to use. The person using it doesn't have to be medically qualified. It can avoid unnecessary calls. If the care home is concerned about readings that they might feel are not normal, then they can contact us for further advice. So it's really showing how it can make a difference for care professionals as well as care providers. So the next piece of tech I'll talk about is Pain Check, who are on the stand just over there actually. So Pain Check is a piece of pain management kit, and it's essentially used on a handheld device where a care provider can assess a level of pain, They will do an assessment separately, but this uses AI technology to identify small changes in somebody's facial expression and perhaps in their voice, and it will detect pain and it will come up with a pain score. So it obviously helps staff to take more accurate assessments of pain and to make those informed decisions. It will integrate with their digital social care records. And in particular, we are aiming to use this with people who have communication difficulties or learning difficulties or dementia, that sort of area. So it's relatively new to us. We had a very small pilot that's run almost a year. We've rolled that out much more widely across Bedfordshire, Luton and Milton Keynes. And the anticipated benefits at this point are things like, obviously, we aim to decrease pain and understand pain for individuals, which will then lead to improved quality of life, improved sleep. For providers, we want them to make more effective pain medication prescribing, hopefully a reduction in safeguarding incidents, and more confidence in making those decisions and having conversations where they're concerned. And then for the system, again, hopefully reducing avoidable admissions and readmissions and having more collaborative pain management. So we're working on this project with some partners at Health Innovation East and the University of Hertfordshire who are helping us with the evaluation. We've got a really full data set that we're hoping to gather. So everything from the care providers' information to interviews and conversations with the families and the individuals if they're able to communicate with us, and then focus groups with wider system partners as well. To really understand what the impact and change has been here. So again, the tech supplier offers face-to-face training and support, and we as a project team can look at things like the number of assessments and follow-ups that take place. We can look at the pain scores and understand the sorts of data. And I think what's been really clear to us is that it really does need that top-level management buy-in as well as the care provider staff to make sure that it's fully embedded into their sort of day-to-day practice and policy, and we can really start to see some of the difference that it makes. So this case study, I don't know if it's perhaps too small to see, but just to describe it briefly, this is a patient who had advanced dementia and was on end-of-life care. And he was really displaying a lot of distress when he was receiving personal care. And so they brought in Pain Check and were able to assess that he had a moderate level of pain. And he was on basic medication like paracetamol, ibuprofen. And they took him to hospital. And at that point, his pain medication wasn't changed and he continued to display the same level of distress. So with the Pain Check, the score, they could show that he was still in moderate pain, and they used that to go back to the GP and have another data-informed conversation. That led to the GP prescribing a pain patch, and you can see that the dip in the graph, his pain went down. He was much more comfortable. He stopped displaying so many distressing behaviours, and that was a really tangible example of how this can work. So it did start to creep up again, but the care home staff have said they feel much more empowered to monitor and to have those sort of data-led conversations. So RoboPets is another new one to us, part of the same funding stream. And they're essentially looks like a fluffy toy. They're robotic. They don't use AI, but they will respond to sound and they will respond to touch. And again, we're aiming to use these with people who perhaps have communication difficulties, perhaps they're lonely, they need some companionship. So we're using it with both domiciliary care providers and residential homes. And really, the intended impact is that we hope it will bring companionship. We hope it might reduce certain things like anxiety and agitation, improve quality of life, improved well-being for people. Perhaps that reduction in feeling isolated and improving individuals' confidence. For care providers, we're hoping that it will allow them to perhaps give care in an improved way, that they can use this as a tool to manage certain behaviours. And again, that it could perhaps improve communication between themselves and those individuals. And for the system, we're really interested to see what the impact might be, again, on GP call-outs and incidents, that kind of a thing. So initial feedback has been largely positive. We've got some really nice examples where a care provider has used a RoboPet for a lady, and they're issued to individuals, they're not shared. So who was really struggling with vaccinations, and they could use the RoboPet it calmed her down, and they had a stress-free vaccination experience for her, which was really positive. Not everyone has taken to them. Some just don't like the way that they look and feel. I think some people perhaps believe they're real. Others know they're not, but they still take to them. But yeah, as I say, some people just really haven't got on with them well, and so they don't participate in the project. So this just gives you a little idea of what it looks like. It's battery operated, so you can turn it off if people don't like the sound of the movements. The bird in particular sings non-stop when it senses movement, so I think probably for staff they would like to turn it off now and then. And again, just some feedback that we've had just initially, because we're quite at the early stages of this particular project. Just got to flick through those. And I'll read out the one from the residential home where 2 service users have robo birds in their bedrooms. They play and interact with them every day. Interacting with the birds really appears to lift their mood and encourages the service users to chat and interact with staff and other residents. So they like to discuss the bird songs and the noises that they make. And actually, we've seen a number of examples where it's really encouraged communication. We had one couple where the lady talks to the animal but doesn't necessarily communicate with other people. So again, it's been a really interesting tool. So we're looking forward to seeing what the pilot evaluation will bring to us. So the final example I'll talk to you about is the razor chair, and this is probably less digital, more technology, but it's a very simple but effective piece of kit that is built around somebody who has fallen and have been assessed as safe to lift. The chair builds around them on the floor, and then it lifts them up, and you only need one person to operate the chair, so instantly you're reducing the number of carers and staff time that you have to input. It's very quick to do, so obviously reducing long lies on the floor has much better outcomes for people. Again, the knock-on effect, the dignity and well-being for the person being lifted is really huge there. So we have done the evaluation here for our care home project. We had about 174 chairs out there. Again, some of the benefits we're looking for were improving like resident safety, trying to improve their outcomes and the health issues for not lying long, improving things for the care providers by making it more efficient for them, and again, that wider system impact on the reduction of ambulance call-outs, particularly for domiciliary care. That's a separate pilot that we're still evaluating at the moment. But for a lot of them, their process was if somebody has fallen and a family member couldn't come out, then it would be an automatic call out to the ambulance. So we're seeing some real impact there. So these are some of the outcomes that we found. So for each of the care providers, after 90 days, we looked at the number of falls that had taken place at all and the number in which razor chair was used. And for 47% of those falls, they were able to use the chair. So we estimated over 12 months that would save about 890 hours of staff time, which was really something. There's a second staff time saving on the end there, which is the amount of time staff was saving not having to wait for the ambulance. So you've almost got a double whammy. You're not having to spend time, lifting, and then you're not having to wait for the ambulance. We also saw an 18% reduction in ambulance calls during that time, and a reduction of 15 emergency admissions. And again, we put some monetary figures against those. So that in particular was around £80,000 saving over 12 months. So really quite significant. So there's some contact details there. We're always really open to people coming to talk to us, coming to ask questions. Please do feel free to email the team if you're interested in anything there. And I will hang around over by the chairs and tables if anybody's got any questions that you'd like to come and ask. Thank you very much.